One of the most important ways to build up an infrastructure is to train your own healthcare providers, physicians, nurses, and scientists, so that they could have really the most impact when there is a problem and can handle some of the problems so that you don't always have to worry about help from the outside. And that's one of the things that we try to do at NIH is we spend a considerable amount of time training people from developing nations, particularly in sub-Saharan Africa and Western Africa and Eastern Africa, in order to be able to get people trained so that when they go back to their country, they will essentially be the same sort of experts that they rely on calling in when they do have a problem.
But what about the ratio of doctor to patient, really? For example, Liberia, according to statistics, has one doctor or physician for every 70,000 people. Sierra Leone, one doctor for every 45,000 people. That contrasts with the United States, which has one doctor for every 410 people, and even better, in the United Kingdom, one physician for every 360 people.
Well, it's unacceptable to the country. It's not fair to the country to have such a very, very poor ratio of doctors to population numbers. That is a major contributor to the lack of access to good medical care. And that gets back to the question that the caller just brought in a moment ago, is that we need to train more people in the country and to give them the incentive to stay there. Because what happens not infrequently is that you train physicians in a country, in a developing nation, and because the conditions there and the opportunities there are not adequate for that person or persons to develop professionally, they leave and they go to the UK, or they go to the United States, or they go to a European country, and so you're losing the best and the brightest in your own country. So it's important not only to train them, but to give them the resources and the incentives to stay in their native country to perform the services that are necessary.